very difficult war against the epidemic. With these remarks, I support the motion. Next, Mr. Dominic Lee. Thank you, President. Fighting the epidemic, preventing the deterioration are very important to us. And therefore, I think, Mr. President, you are wise in resetting the order of our debate. I think people have been cooperating with the authorities. For example, they queue up in orderly manner to get tested. And the disciplinary forces, the police officer, and the frontline workers have all contributed to this, and I thank them all. I visited different districts and the testing facilities. I see people queuing up in open air and queue up to get the test. And once this is done, and a long wait is expected the next day to do the same. And some people are saying that that we should be more passive. We should try to live with the virus. We must not succumb to such request. Once we give up this dynamic zero approach, it will mean that we'll never open up our boundary for the communication with the mainland. How can we go down this route? We have to come together and we have to be determined in fighting the epidemic. Earlier, a number of LegCo members signed a petition asking the government to seek support from the central government so that we can have a higher capacity for testing and for quarantine. I thank the support from many people in the community. 30,000 signatures were collected. The government has partially responded to our request. The government has asked the central government for more support, and we are now getting the renamed registration platform for the vaccination records. I understand that it's difficult to get a community-wide testing campaign implemented in Hong Kong, which is so densely populated. But perhaps we can go to different districts. We can do this district by district. Once a district has been tested, people can move freely within the same district, but not to another district, which has yet to be tested. If we do this district by district, the disruption to people's life can be shortened, and then we can put a stop to the transmission chains earlier. If we look at the number of beds in our public hospitals, we'll not be able to cope, even if we are just talking about the current level of confirmed cases. There are people who are waiting for a long time to get a hospital bed, and their family members sometimes are infected as a result. We should make use of other resources. There are premises which are left unused because of the epidemic. We should commission all indoor sports venues, hotels, university student hostels, and even the AWE, the Hong Kong CEC, Hong Kong Coliseum, and even Hong Kong Disneyland facilities for this purpose. Secondly, we have to try to get more people work for our healthcare system. Our healthcare workers are fighting very courageously in the face of the severity of a risk. The private sector, in the private healthcare sector, is just serving 16% of the population, while the bulk go to the public sector. So if we can get some help from the private sector as well as from the mainland, we will be able to do this much more efficiently. People are concerned about whether we have a legal basis to allow mainland healthcare personnel to work in Hong Kong. Actually, under the law Cap 599, that during a public healthcare emergency, the government is authorized to allow people to act in a professional healthcare capacity. If this is not a risk that we're facing, I just don't know what this is about. So why don't we think about this along such a concept? We need a lot of manpower, apart from police, and even we can have the CAS, the auxiliary medical services, and St. John's ambulance service. We have more than 3,000 CAS and more than 3,000 AMS services, and there's 6,000 members under the St. John's ambulance service. And our boundary cross points are now closed. So what about using the service of the 7,000 immigration officers? We are now trying to establish a dedicated vehicle fleet to take people to the relevant facilities. I think we should allow these people that we can marshal to help manning these transport stations.
I believe that many people, including myself, are more than happy to volunteer. If we still short of people, we can ask the central authorities to assign extra manpower. The central authorities always have our back. They'll be more than happy to support us. Dear Hong Kong citizens, this is the most critical stage in our fight against the Omicron. We need to put our hearts together with determination. Well, according to my nominee, Dr. Lo Chung Mao, if we choose to live with the virus, then we will die with the virus, even though we're in great difficulty or we couldn't see a way out. However, we should not give up or surrender. We Chinese cannot lose. If we can adopt all the measures I mentioned, I believe that universal testing is not a myth. Dynamic zero cases will become a reality. I'd like to take this opportunity and occasion to express gratitude to our frontline workers. I salute your contribution for your commitment. I so submit. Next, Ms. Lillian Kwok. Thank you, Deputy. First, I would like to thank the frontline workers and disciplinary forces and the volunteers who have been fighting the epidemic for the past 2 years. And second, I would like to thank the government that has adopted our suggestion in fighting the epidemic. Over the past few days, we've heard that seniors and children infected and lost their lives, and lots of people are waiting outside any department in cold weather, and people couldn't get their testing results 5 or 6 days onwards. It seems that at every aspect of our effort has exceeded our capacity. I would like to thank the central government care concern for the Hong Kong. They will always respond to every request of Hong Kong. Even though motherland can offer our support, however, we need to do our part to prevent the spread of cases in the community. That's our top priority. Even the government was behind the curve with the central authorities' support. It is now playing catch up by trying to build more isolation facilities. However, these facilities need time to complete it. We now have a large number of cases could not be admitted to isolation facilities and must undergo home quarantine. The government claims that only the right environment can serve as home quarantine. Well, for example, a family of 12 living in a public housing unit or those living in subdivided units, I believe that these would not be served for home quarantine. And some of the confirmed cases had infected all their family members, and their babies had ran out of formula. He knows that he cannot leave their home and asked the government for help. The government replied that she should ask her relatives for help. And he claimed that the baby would need to food. However, he could only leave home and bought his baby the formula without any protection gear. The government is asking the fellow members to support the infected. I don't see that as a reasonable solution, and some of the infected persons contacted the support hotline. However, they couldn't get through since yesterday and could not leave a voice message. I noticed that a lot of the people are willing to cooperate and trying to stay at home to prevent infecting the community. However, the government support cannot reach them. The home quarantinees, including the infected, are forced to go into the community. Besides the issue of home quarantine, the residential homes are in dire straits. While the confirmed cases are asked to be quarantined in situ, the elderly homes hope that the government can provide anti-epidemic supplies and RET testing kits, and yet the government departments deflect responsibility. And finally, the staff asked for help with the contact tracing office, and they managed to secure some kind of supplies for them. The infected staff and the residents are stuck together, and with the dwindling supplies, and most of the residential homes do not have any or protect PPE. This is unsatisfactory, and yet they don't know where to seek help. In the short term, home quarantiners and support for the residential home residents are top priorities, and I strongly urge the government to coordinate and mobilize support group at the district level to support home quarantiners with supplies and provisions, and so that we can prevent less infected cases from forcibly entering the community. And the government should harness the manpower, including rehiring retired civil servants, create short-term positions, and organize community volunteers. Second, on behalf of the residential homes, I beg the government to contact homes with infected cases and support them where necessary, especially in providing anti-epidemic supplies to PPE and masks. Thirdly, I hope the government can harness technology so that the home quarantiners, besides the hotline, they can use WhatsApp, WeChat, and email to stay in touch. Besides the pressing question I answers, I also have the following suggestions. For quarantine or isolation, I hope that the government can make use of sports centers and sports ground to set up trial centers to isolate the infected cases and waiting for confirmation and further arrangements to reduce the number of cases in the community. And I thank the central government's support in enhancing our testing capacities. However, the government should implement universal testing or large-scale testing to identify infection case and cut the transmission chain, providing enough RAT kits so that those in need can test themselves at home to identify infections. Besides volunteering testing, I hope that we should encourage more vaccinations so that those who are keen can get vaccinated. Currently, the elderly and the children and ethnic minority vaccination rates are very low. We should set up more vaccination centers, especially for targeting the aforementioned demographics. And we can also provide vaccination for those on two-way permit and those on reconnaissance papers. And finally, it should harness technology to enhance contact tracing capabilities for appointment or the vaccination or even telemedicine consultations. Hong Kong is in a state of war. Everything is in a state of flux. The government should abandon its old mindsets. The anti-republic policy should be ahead of the curve and enhance collaboration and improving the current SOPs. I hope the government do a better job coordinating. Like the President Xi said, mobilize all forces and resources that can be mobilized and take all necessary measures. The government and the citizens should be in solidarity to defeat the virus. I appeal to the public to cooperate with the government and to reduce the pressure on the front line. If we share the same goals and put our minds together, we can weather the storm together. With the support of the motherland, we are confident that we can emerge from the epidemic. Hong Kong can restart its economy and reset. I support this motion of thanks. I so submit. Thank you, Chairman. Next, Ms. Chan Yut-ming. President, Hong Kong is now in the grip of the fifth wave of COVID-19. Can you hear me? Please carry on. We're in the grip of the epidemic. From last week, the single day caseload had exceeded 1,000. And yesterday, we have 5,000 preliminary positive cases. The speed of proliferation exceeded the previous waves. According to news reports, the public hospital beds are almost full. Lots of the confirmed cases can only quarantine themselves at home, waiting to be admitted. At the same time, the vegetable imports from the mainland was disrupted, and the latest development and has overwhelmed the government. The motherland has always the strong sort of support of Hong Kong and always had Hong Kong's prosperity in mind. And on Saturday, Chief Secretary John Lee led a delegation to Shenzhen to attend the thematic meeting on COVID-19 epidemic and asking for the central government support, including Senate mainland experts to coordinate for genomic screening to boosting our testing capacity and how to build the quarantine isolation facilities and provision of rapid test kits and medical supplies like masks. The central authorities have accepted the proposals by the Hong Kong government. We immediately noticed the central ministries and the Guangdong's provisional government have sent expert task force and the testing personnel to Hong Kong. And the mainland enterprises in Hong Kong and secured supplies and the 300 isolation cubicles have been imported to Hong Kong. The Huayang laboratory have been commissioned can handle up to 300,000 specimens for testing. With the central government support, the chief executive mentioned in the press conferences that the government shall stay with the dynamic zero cases policy and do not object to universal testing and will requisition public housing units for isolation and support the procurement of more RT kits. I don't see that CE is going far enough. 2 more years in the pandemic, there has been a lot of fatigue. The government cannot do with the eyes closed. We should set clear goals so that we can work towards that goal and let Hong Kong emerge from the epidemic. President Xi cares about Hong Kong and issued an important directive and stressed that the whole government to take main responsibility in containing the 5th wave and placing top priority on stability and people's lives. And they should make it overriding priority and mobilize all forces and resources that can be mobilized and take all necessary measures to ensure the safety and the health of Hong Kong citizens, as well as to ensure the Hong Kong social stability.
With the support from the central authorities, I would expect that the government will be able to take up the responsibility of fighting the pandemic. And we should also strive to have the entire community working together. Outside of the civil service, there are several things that we can do. Number 1, Ms. Chen, please turn your face a bit to the left so that you can face the camera. So please move it a bit sideways so we can see you better when you're in the middle of the screen. Okay. We will also have to learn from the experience of the mainland in fighting the pandemic so that we'd be able to cut the transmission chain, and then we'll be able to make the best use of our testing capacity, and then would also be able to triage the patients so that they would be able to get timely treatment. And we should also build major quarantine centers like what was done on the mainland. And also in the mobile, in the Leave Home Safe app, we should also include the capacity of tracking the whereabouts of the person. And we should also enhance the vaccination and also the testing resources in particular. We will also need to look at relaxing the rule of taking a follow-up jab only 6 months afterwards. Sixthly, we should also distribute appropriate resources so that for those living in the rural areas, the vaccination rate can be boosted. Well, the rural area is quite remote, and therefore many people simply have no access to such resources, and therefore we will have to set up mobile vaccination vehicles so that villagers will be able to take the jab more easily. And that shows that the current vaccination services simply are not able to meet the demand. And therefore, I'd like to acknowledge the help offered by the Civil Service Bureau, because they're really offering help where it's needed. We should arrange for more such vaccination vehicles to go to those areas, because there are many elders living in those areas and they find it hard to go to the vaccination centers to take the jab. We should also do it in a more orderly manner so that would be able to achieve the objective of dynamically clearing all cases. So these are my remarks. I support the motion. Next, Mr. Kenneth Wong. Mr. Deputy, recently many people share my sentiments. We have a heavy heart because we can see that young kids as young as 3 or 4 years old, and also elders at the age of 100 have been infected. Fortunately, this morning we have heard this most encouraging news. That is, the General Secretary, Mr. Xi Jinping, supports Hong Kong's initiative in fighting the pandemic. He has given a very important instruction to the SAR government. So the SAR government's initiatives will definitely be supported by the central authorities, including the provincial Guangdong government as well as the Shenzhen government. And as to what has been said by Mr. Xi on the Central People's Government support for Hong Kong, I don't think I need to repeat that. But then there are several things that the SAR government has yet to ask the Central People's Government to do for us. We can see that on the mainland, they've been able to control and contain the pandemic so effectively, and they've been able to cope with the situation, and they are able to host the Winter Olympics so successfully. I think this is a very important experience that we can learn from, and therefore we have to have breakthroughs, because we do have a very rigid healthcare system right now, and we should mobilize the 8,000 plus traditional Chinese medicine practitioners so that they can also play an important role in fighting the pandemic. I suggest that we should invite the TCM experts from the mainland to come and join our team in fighting the pandemic. And under the Anti-Epidemic Fund, yesterday we passed the 6th round of funding, and I think some resources should also be set aside for the use of TCM in treating the patients. And we should also build more Huoyan laboratories. These are the makeshift laboratories. So under the laws of Hong Kong, with the consent of the public, can we also send some of the specimens over to Shenzhen or other places in Guangdong for testing in order to increase the capacity of testing, so that that can meet the current demand? And I understand that public hospitals, including the children's hospitals, are nearing saturation. And so with the consent of the patient's consent, can we ask the central authorities to do this for us, so that some of the patients can also be triaged, and they can also be sent over to Shenzhen, for example, to the Shenzhen branch of the Hong Kong University Hospital in Shenzhen, so that they can be treated there. And of course, we would also need to boost the capacity of Hong Kong. In Hong Kong, we have been using the Leave Home Safe app for quite a while, and yet there are many loopholes and shortfalls and pitfalls. I don't need to repeat them here. Many members have spoken about that. And I've also downloaded the health code for Hong Kong. I don't understand why. Over 1 million people who have already downloaded the Hong Kong healthcare or Hong Kong health code, and yet the administration still has not really advocated the use of it in Hong Kong. And of course, for those who have downloaded the app, they'd very much like to go back to the mainland, and therefore we would be more than happy to share our personal data with the Hong Kong government. And therefore, if we can commence the use of health code in Hong Kong, then that would also help with the tracking work. And if we were to get out of this pandemic, we would need to do something about it. For example, our logistics industry will have to be revamped. For example, in para 43 of the policy address, it says that we will have to build a smart harbor. But then we are still in the stage of conducting studies. So we'd like to build a smart port. So how can we get a very clear vision and roadmap so that we can make the best use of the tools available to us? For example, we will have to set up the standards for smart port, and when can we achieve the required technical standards, and where can we get the land for that? And also, what about the tonnage and throughput of our containers and so on? To what extent do we have to boost that in order to meet the requirements? And the administration must come up with the criteria. And also for the logistics industry, we will have to beef up our support for the SMEs, because some 98% of the import and export companies are SMEs, and they've hired some 80% of the workers in Hong Kong. And for the trade and logistics industry, they have accounted for some 20 to 25% of the GDP of Hong Kong, and they are the pillar industries in Hong Kong. Therefore, I would suggest that in coming up with this plan for developing Hong Kong into a trade center, then we will have to take on board the views of the SMEs, and there should also be sufficient policy support and guidelines Next is about helping the business sector so that we can make the pie bigger. Well, we have the RCEP, that is the Regional Comprehensive Economic Partnership Agreement that has been implemented, and Hong Kong is a very important trade partner for many economies in Asia, and we have also applied for joining that program. And we should liaise closely with the central authorities so that we can join the RCEP as soon as possible, because that would also help find a new way out. And also in the policy address, they also talk about digitization or digital economy. Well, they only talk about a smart city, but then it's just a very small component of the digital economy. From the target objectives to the development focus, they are very different. Well, digital economy has been one of the main initiatives under the 14th Five-Year Plan. And our country states that by 2025, in terms of the core industries under the digital economy, it's hoped that it can account for some 10% of the GDP, and then in 10 years, by 2035, we will have a very mature market mechanism and would be at the forefront globally. And in fact, Mr. Xi has also written to this very famous journal. He said that would have to make our pie bigger and better, and we have to expand our digital economy, and therefore we would also have to have plans in place in order to converge and align with our country's initiatives. And we would also have to identify the area that we can develop in our IT sector, and we would also have to plan ahead. For example, Hong Kong's 5G has been a very important infrastructure for our digital economy, and therefore we should attach more importance to the development of our 5G infrastructure. Instead of just allowing the operators to build the infrastructure, we should invest in the infrastructure ourselves. We should also have medium to long-term low-interest loans in order to promote such developments. We should set up matching grants in order to enhance the development. We should encourage the trade to remove all the barriers for such developments. With these remarks, I support the motion. Next, Mr. Bill Tang. Good afternoon, President. Thank you, President. My remarks will be a response to the motion of thanks on the policy address, and I'd like to take the opportunity to say this to the healthcare professionals, the support staff, and also all those from the civil service, and also those in the medical teams, in particular those volunteers in the community. In the past couple of days, what's most heartwarming is that a group of taxi drivers have been willing to take the risk by taking the passengers to and from the dedicated clinics, and our country, in particular Mr. Xi, have been very concerned about the well-being of Hong Kong. And Mr. Xi has also instructed that we should spare no efforts in fighting the pandemic, and all resources should be put into fighting the pandemic. So I'd just like to say a few words about the three beliefs. One, we have to believe in science. So it means that vaccination should be done as far as possible. And as some members have repeatedly said, right now there is a bottleneck, that is testing capacity. Next, within the near term, if we were to conduct extensive testing for those that have been identified to be positive, then do we have sufficient isolation facilities? So that's a bigger bottleneck. But then I believe that vaccination should be equally, if not more important, and therefore we should put in all the resources in order to boost vaccination, because only when we have more people willing to take the jab in the short term, then even if they were infected, then the harm done to them would be minimized. And therefore, the burden on the healthcare system, including the isolation system and also the treatment centers, would also be taking less burden. But then when it comes to vaccination, when I look at the daily figures, okay, for the infection figures, Well, for the vaccination figures, can we boost it so that it can reach 70,000, 80,000, or even 100,000? So where is the bottleneck right now? Is it that we don't have enough jabs? I don't think that's the case. Is it that we don't have enough venue for vaccination? Then that depends on whether or not the administration is willing to mobilize all the venues available, including all the 1,000 or so school campuses. We can use their assembly halls and so on. And also, why can't we just reach out and provide vaccination service at home? And do we have enough manpower? What about qualified personnel to do the jabs? Well, that might be the case. If that is the case, then we can resort to two measures. One, we can get an organization like the HA so that it can train up enough people within a very short space of time so that they can do the jab or do the injection for us, so that they can form mobile teams. And we can even make use of the healthcare professionals from the mainland. They can just come over to provide the injection for us or inoculation for us. We're talking about millions of people that have yet to receive the jab. And if they're able to go to their homes to do the inoculation, then that would definitely help.
Secondly, we need to look at Chinese medicine, not just the Lianhua Qingwen capsules. Under the national health ministerial guideline, there are three kind of prescribed drugs. Lianhua Qingyun capsules are for minor cases. The first time I bought it, it cost me $20. Now it costs me $100. So we have this treasure in Chinese medicine. It's been proved to be effective for chronic cases. So why can't we give this to those who are put under quarantine, especially home quarantine? If we want to integrate Chinese and Western medicines, we should make the best use of the medicines which have been proven to be effective, which have been marketed in more than 20 countries. Yesterday, I went to a big pharmacy, and I was told that whenever we have a fresh batch of supplies, they will be taken up very quickly. If home quarantine is one of the measures that we want to introduce, then we have to look at the home environment. Subdivided unit is not suitable for home quarantine. It's not just a congested space. And also these units are located in buildings not managed by anyone and with no owner's cooperation. As there's no one who would do the disinfection even when there's a confirmed case next door. So we should examine people living in subdivided units for home quarantine measures. Otherwise, we are going to have a lot of serious infection chains in the community, especially in Kowloon. FTU has established a team of volunteers. Many people are asking how they can contribute to the efforts instead of becoming a problem themselves. For example, can we designate some volunteer groups and offer them COVID insurance coverage and also give some guidance? For example, if we have more than 10,000 people put under home quarantine, you need people to man the telephone hotlines, and the volunteers would try to get in touch with them and understand their needs. Thirdly, we have to have trust and faith in our motherland. China has been achieving remarkable results and are well known globally. And the Winter Olympics that we are hosting has demonstrated to the world that we are quite capable of controlling the epidemic while we strive to restore normal social activities. So we have the biggest guarantee in the form of the support from the motherland. So we have to have faith and trust in our country and in the community. And once again, I would like to thank all the people working at the front line, including those working in the Huoyan laboratory, which I visited yesterday. With this remark, I support the motion. Mr. Tang Fei, first of all, with regard to the support extended by the central government, especially the authoritative remarks made by President Xi, I must say that I'm very deeply appreciative. Whatever we can do to safeguard the public health of Hong Kong people, that we should give it the full support and cooperation. And the authoritative instructions would help us overcome the disruption and that difference in viewpoints. The government should convey the message in very clear terms to the public. We have seen a drastic increase in the number of cases. It's not the biggest source of fear. A bigger factor is the chaotic information they are receiving, and the organization of work is not very well done. It's time the government became a highly organized command center. Otherwise, we cannot really be specific and effective in fighting the epidemic. But the government is stressing the need to increase the number of tests that can be conducted. But what about the triage arrangement after that? We must separate those with mild symptoms and those who are asymptomatic or require immediate treatment. If we cannot do a good job in that, there will be chaos. We have now 7 community clinics, and we have set up a fleet of taxis to take people to these facilities. Are we going to have people quarantine at home, or are we going to have people with different severity of symptoms going to different facilities? Full government arranged transport. Although we are seeing the vaccination rate going up all the time, but elderly people tend not to get vaccinated. Well, how about introducing the opt-out mechanism so as to boost the vaccination rate? What about vaccination for children? Do we want parents to take their children to their schools for vaccinations? Also, we mobilize private clinics to offer the jabs so that parents can just go to a nearby clinic for vaccinations. Has the government estimated the manpower requirement and the administrative measures required so that we can have a proper triage system and to reduce the need for people to go to a community clinic or a hospital for testing or vaccination? Yeah, and are you going to introduce a permit system? Do we need to have both the Lee Home Safe functions enhanced, and at the same time, can we introduce a health code system like the mainland to take the place of two? And many members have talked about leveraging on Chinese medicine. It's not just about certain prescribed medicine. Actually, in the national strategy, page 7 and page 8, there are different prescriptions for different people with different symptoms. Why don't we involve Chinese medicine practitioners from the mainland? Can we go for community-wide testing or district-based testing, or can we have a time-limited lockdowns of different districts like Shanghai, or do we just rely on the voluntary testing and voluntary vaccination? We must come up with a choice, the right choice for dealing with the epidemic, so that we can accurately estimate the manpower and the resource requirement, and then we can ask for support and from the central government, and we will be accurate in estimation. The government should tell the public and this council in no uncertain terms what the government would like to see implemented as a matter of strategy. And I also want to show my deep appreciation for those all those people who have been working at the front line. Let's hope that Hong Kong can emerge from the epidemic through our collective hard work, so that we can reopen our boundary and reconnect with the country, and then we will be integrated in the national development program, and we can start off once again. I support the motion. Ms. Alice Mack, President, first of all, I'd like to thank all the people, all the workers, volunteers, working very hard to fight the epidemic, whether they are civil servants or people working at testing centers, or as Mr. Tan Ka-biu, people who have been working at the Huoyan laboratory. I thank them all, because this fifth wave is a vicious one, and we need a lot of people to help us. It's fortunate that we have such dedicated people working for the fight. Today we have an unprecedented or record high number of cases, more than 10,000 confirmed cases who are all waiting to be sent to hospitals. As LegCo members, we receive requests every day from people saying that they have been confirmed, but they don't know when they will be sent to hospitals. There's just so many cases. People are worried, and the central government certainly know about this sentiment. That's why we have got the instructions from President Xi. The instructions are really about the delineation of responsibility. And they have been showing us unwavering support. But the main responsibility rests with the SAR government. It must mobilize all the resources to do this. In the community, many people are aware of the serious situation. Many people would like to do their part. We in the FTU has set up a team of volunteers, and we receive more than 1,000 applications. Very quickly, I received a request from a hotel owner saying that he is willing to help, but we don't know who we should approach in the government to make it possible. Many people would like to contribute to the collective efforts to fight the epidemic, but these resources have yet to be fully mobilized. the government should come up with some coordination people to make sure that such contributions can be fully utilized. And also the SAR government should make sure that disclosure of information is made as transparent as possible. In some international media are mirroring our measures every day. A few days ago, I listened to a BBC interview, and I was outraged by what I heard. The government should deal with such misinformation and rumors. Clarification must be offered right away. We must not be smeared by these people. And some people are misinformed. They are saying that the hotlines are difficult to get through. And they, of course, if they cannot get anyone through to listen to them, they are, of course, disappointed and they are at a loss. Many people in the community are willing to man such a hotline service to help reaching out to the needy people. What the government should do is to offer proper coordination. And many young children are now staying at home. Classes are suspended. There's no face-to-face classes at present. They have Zoom lessons at home. So there's a lot of time for them at home. So they would just play video games or listen or watch TV. But there are not many TV programs which are suitable for children all the day. So why can't we make use of the relevant platforms to disseminate epidemic-related information so that we can have more transparency in information and people can be more knowledgeable?
Well, in the policy address is what we're discussing today. There's one item on the government reorganization. Well, he mentioned that the Food and Health Bureau will be renamed as the Health Bureau. I see that as a key proposal and also important for our public health system. Why do we feel that the government has been rather helpless in this epidemic? As the Bureau cannot concentrate on public health, the Department of Health is a very small department. After the government restructuring, you should focus on expanding the functions of the Department of Health to leverage technology and big data. I need to prepare in terms of policy formulation. Once again, on behalf of FTU, I would like to thank the other personnel fighting the epidemic, and as well the mainland personnel helping Hong Kong, and for the volunteers working in the community. I would like to send my condolences to the patients and the families. I believe that with the nation's backing, that Hong Kong should do their bit. As soon as we pick ourselves up, we can overcome this epidemic. I hope that the government can mobilize the civic society, that the FTU volunteer teams are standing by and they help ready to fight the epidemic anytime. I so submit. Mr. Wong Kwok, Kingsley Wong. Thank you, President. I'd like to take this occasion to thank the central authorities for the importance attached to the Hong Kong COVID situation and full support. And I would like to thank the assistance rendered by the National Association of Unions. Please carry on. By sending us anti-epidemic supplies to the Hong Kong population to guard against the epidemic. I'd like to thank the frontline and healthcare staff and security staff and cleaners. And just now, My colleagues have come up with a lot of sound proposals. I just want to supplement with 3 points. First, I'd like to Hong Kong government, with the support of the central authorities, can formulate the effect, goal, and strategy and tactics to achieve dynamic zero infections, not only to show the government's determination and capabilities, as to let the public notice in order to bolster their own confidence. The mainland has accumulated a lot of experience in achieving dynamic zero infection and willing to provide Hong Kong with enough supplies and manpower. And during the fifth wave, our protection net has been broken. I received a lot of complaints. They could not receive the testing result 5 days after testing. And after being confirmed many days, they are not sent to quarantines and pass on the infection to the family members. With support of these mainland experts, we need to adjust our strategy and enhance various measures to effectively curb the epidemic. To let the public notice that the new measures can really pay off. And so they can receive the test results quickly. Once confirmed, they can send to isolation and treatment quickly. And second, fighting the epidemic requires all hands on deck. Well, this is need to have a wartime mentality. If necessary, we can invoke the emergency regulations ordinance. Extreme times call for extreme means, restricting personal liberty for the sake of beating back the epidemic. Specifically, we need to stop the foreign domestic helper gathering en masse and beefing up vaccination on children and the elderly, and to strictly enforce the vaccine pass. And seriously consider strengthening the tracking function of Leave Home Safe, leveraging technology for more effective and quicker tracing of risky individuals. And thirdly, we need to mobilize the civic society to donate either their time or money to fight the epidemic. I welcome the government has adopted my suggestion to mobilize the civic society to organize a taxi fleet to pick up infected cases. Hong Kong people will always come together in times of crisis. I know a lot of NGOs have formed their volunteer teams. They have to organize a 1,000-strong volunteer team. I hope the government can emerge from this old mentality to organize the social resources. I have a few suggestions. If we lack personnel in collecting specimens, can we train our beauticians and other service personnel for this task? In the past, nurses were responsible for drawing blood, and then we handed over tasks to phlebotomists, and the government is now under a severe manpower crunch. And for the less essential tasks, can we pass on to the volunteers? For example, handing out supplies and maintaining orders. However, we need to offer protection for the volunteers so that they won't get infected by guaranteeing them enough PPEs in case of infection, and they will also get timely treatment. The government should dispel the concerns of volunteers by encouraging more people to fight this pandemic. President, I believe that Hong Kong, with the central authorities' backing, as well as support from all walks of the society, can beat back the pandemic. I so submit. Dr. Priscilla Leung. President, can you hear me? Well, fighting the epidemic is just like war. We can't fight this alone. The Hong Kong team must work with the mainland team to beat back this mankind's greatest enemy. Everyone can see that the healthcare staff are doing all their best. Thus, I would like to take this occasion to thank this frontline healthcare staff and cheer for them. However, fighting the epidemic is not just about the medical job. There also is an issue of governance and a matter of survival. And our status of our international status is at stake as well. For the sake of social stability and people's livelihood, Team Hong Kong and mainland team are working shoulder to shoulder. I would like to thank the President Xi's making an authoritative comment on an instruction to Hong Kong. The mainland authorities shall send a lot of resources to help Hong Kong fight this battle. This is a strong shot in the arm, and it notes that local government takes main responsibility in containing the fifth wave. Well, an 8-month pregnant woman was infected, and a 3-year-old girl was infected and passed away. This Omicron variant should not be taken out lightly. The epidemic has also took away the life of my very dear friend. It's not just about a disease and not just about the 7.5 million people. It's about the welfare of 1.4 billion people. Can Hong Kong rapidly integrate into the national development framework like the 14th Five-Year Plan? That's a matter of national importance. President Xi mentioned the under one country, two system. Hong Kong should defend two things. First, defend national sovereignty, and two, defend social stability and make active contribution to one country, two system. During the 2019 Black Flag riots, it undermined national security. Thus, the central authorities drafted the national security law to stop the chaos. In year 2022, for the Omicron outbreak, and Hong Kong has a preliminary case of 8,000, and the country's care for Hong Kong is well demonstrated. The mainland's relatives keep showing their concern to Hong Kong, demonstrating blood is thicker than water. At this time, there's still some in Hong Kong advocating spreading the virus, and some proposing to live with the virus, and some refuse the mainland personal assistance and claiming there are differing standards. If a lot of people are waiting to be rescued at the sea, do we have to ask where the floating device are made in? We should put lives first. It's not hard to think in other people's shoes. Therefore, I welcomed Vice Premier Han Zheng. With the National Health Commission and the Hong Kong Macau office will take the lead, and the mainland experts and the Guangdong government and the Hong Kong government will set up a tripartite cooperation mechanism. It is the best and most effective and straightforward way to boost our capability. President, during the epidemic, I counseled the government on many occasions that we should set up a joint pandemic coordination committee so that our experts and the officials can talk directly, and so that we can implement the mainland hygiene standards, and also we can help to construct the Hong Kong version of the Ark Hospital. As we should learn from Shanghai's experience in controlling the epidemic and boosting the tracking function real-name registration. We must have a timetable. President Xi's instructions and Vice Premier Han's advice demonstrate the central authorities has noted the views of Hong Kong and took a personal interest in it. The nation's care offer a glimmer of hope for Hong Kong residents. Once again, I'd like to thank our country. In the meantime, I still hear from some that Hong Kong's law will not allow mainland medical supplies to offer medical services, including vaccination, or the law does not forbid universal vaccination or tracking. While the Hong Kong law permits the mainland medical personnel to help us, it's a matter of determination. In the light of this overriding priority, including all the religious and psychological obstacles should all be removed. The International Human Rights Convention Section 3 provide exception for public health in placing restrictions on personal liberty. Therefore, I don't see that there is a legal issue. And on National Health Commission, Mr. Leung mentioned that if Hong Kong want to reopen its orders, it must meet the mainland standards of dynamic zero vacations. And reopening our borders as the Hong Kong people's wish, we don't have a choice. That everyone must put aside their prejudice and baggage and mental block. For the Hong Kong delegation, if they want to win gold medals in the Olympics, then they would exchange in the mainland before winning the medals. We should have a common goal of saving lives, and the medical person from both sides will do their best, and the coordination sides will achieve something. Everyone in Hong Kong is in the same boat, including the legislature and executive branch. As legislative members, we must demonstrate patriots administrating Hong Kong and solve problems for the people, and on the same page of the government, we should proactively providing advice to the government. At the same time, I hope that the government see the legislative members as partners. I believe that the proposals raised today are for the sake of loving Hong Kong, loving the country, and loving the people. I believe that Hong Kong people are very self-disciplined and very patient and willing to help. A lot of the NGOs, including those in ethnic minorities, get in touch with you and said they are willing to organize make available some vacant sites for the government to use anytime.
So it's for the government to coordinate. I believe that where there are adversities, there are also opportunities. With the strong support from the Central People's Government, if the Hong Kong government is able to mobilize the community, then would be able to work together to rise out of this pandemic. So we'll be able to reopen our borders. These are my remarks, Mr. President. Next, Mr. Untitled Chapter. Mr. Stanley Ng. Thank you, President. First of all, I'd like to express my support for the motion of thanks motion. The policy address was announced in October last year. At the time, we still didn't have the fifth wave of the epidemic. Now, while we are debating the policy address, we have already seen the outbreak for over a month, and yet we still haven't seen this bottom-out situation, and therefore many people are very worried, and there are a lot of anxieties in the community. At the same time, what we have seen is that majority of the public have been working very hard to tie in with government's initiatives in fighting this epidemic. Despite the fact that we have the epidemic, we are still very pragmatic. In fact, over the past couple of years, in terms of prevention of the pandemic, there is still something to be desired. We have only been able to do the bare minimum. For example, for the testing facilities in the districts, well, inevitably, we're going to have difficulties in the near term. And as the facilities are inadequate, we have not been able to contain the outbreak of Omicron. And our facilities have been paralyzed. Fortunately, the SAR government has taken prompt action by asking the central authorities to help. And the central authorities have also responded positively to this by giving us an all-out support. Are we able to fully utilize the advantages of the one country, two system by tapping into the resources of the central authorities? That would be very dependent on the initiative and determination of the SAR government. Yesterday, the chief executive clarified three things. One, the administration will insist on this dynamic zero infection policy. And the SAR government will be shouldering the main responsibilities. As the pandemic is developing, we will have to enhance our measures, and the SAR government will be working together. And it has never given up, because it has insisted on taking the responsibility for assuring the health and safety of the public. I would like to confirm this positive attitude of the SAR government, and we should work together with the different quarters of the community so that we can emerge from the epidemic together. So once again, I'd like to urge the SAR government to strengthen this collaboration so that we can unify together, and the SAR government should take the leading role. And we have to be resolute, we have to be determined, and we have to insist on taking responsibility for the safety and health of every member of the community. We must persevere on this dynamic zero COVID policy. And the central authorities have given us their unconditional support, and both the FTU and many members of the public would have this heartfelt gratitude. Where there is need for help, we have been able to garner all the help that we need from the central authorities. And therefore, we have to give our full support to the SAR government. And of course, as lawmakers, we would also have the responsibility to monitor the performance of the government in dealing with this epidemic. Yet, even if we have criticisms, we have to be positive, we have to be constructive. That's because we are patriotic, because we share the same heart, because we're trying to build a better home for all of us. That's the reason why a couple of days ago, we have already formed a 1,000 strong volunteer team so that we can offer mutual help to one another wherever we can. We would do our best to work with the SAR government in fighting this epidemic. Here, I'd like to specifically thank everyone at the front line, whether they are healthcare professionals, cleaners, security, chauffeurs, and so on. Well, this kind of sacrifice for the good of the community and commitment to serving the community would mean that all the anti-epidemic measures can be implemented fully. And many lawmakers have made very constructive suggestions today. We have to protect our frontline workers, and we also have to give them backup support so that the work will be done very carefully, so that they can focus their attention on their jobs, and they will also be given support. We should also recognize and acknowledge the fact that the administration has been able to take on board constructive suggestions. I hope that they can redouble their efforts in this, and I'd like to make a number of suggestions here. First, I hope that the government will enhance its efforts in supporting and helping those who have been affected, whether they be infected or they have been isolated or quarantined or they have taken the jab and so on. We have to enhance the efforts. Secondly, where necessary, in particular, we haven't really seen the height of the epidemic. According to some commentators, we might have to wait till March when the numbers peak, and we can have as many as 100,000 people who might get infected. So the SAR government must consider invoking the emergency or the state of emergency law so that we can mobilize all resources available, so that under the emergency law, we can take extreme measures to deal with the situation. We should not be subject to any constraints. And we must insist on this one country system when it comes to fighting the pandemic. We have to align with our country before we can enjoy the freedoms of two systems, so that we'll be able to reopen the border and then our economy can be revived. Thirdly, I hope that the government will consider making the best use of traditional Chinese medicine for treatment of COVID. Recently, some enthusiasts would like to donate several million doses of proprietary Chinese medicine to Hong Kong. But then, because of some packaging problems, there were problems. In fact, such proprietary Chinese medicines have been proven to be efficient and effective, and they have also been approved by the relevant authorities on the mainland. How come we are not allowing them to be imported into Hong Kong? Finally, we hope that we can step up publicity, and also we can improve on the dissemination of information. We should also mobilize all efforts so that we can have all the determination that is needed to fight the epidemic. I believe that in a community, so long as we can unite, and if we have solidarity, then we'll be able to win. Mr. President, this policy address has seen some vision and forward-looking. It's very forward-looking when it comes to future development. Still, there is room for improvement. For example, how can we seize the opportunity of our national developments in order to alleviate poverty? There is still a lot of room for improvement. There are many areas that we have to work on. So in the later sessions, I'll be speaking on the different areas. Overall speaking, I hope that through this motion of thanks debate, in the coming days and months, the ESL government will be able to deal with the epidemic and livelihood issues more effectively, so that we can benefit the public, so that we'll be able to play our role in supporting our national developments. Thank you. Mr. Ma Fong Kwok. Thank you, Mr. President. We'll be speaking on the Chief Executive's policy address. We are having this motion of thanks debate. But then first, I'd like to say this to those who are fighting the pandemic at the front line, and also the vaccination staff, and also the port control staff. In particular, I'd like to say this to the Central People's Government, and I'd like to express my heartfelt gratitude for their support and contribution. Well, during the fourth wave of the epidemic, the ESL government has been able to make or accomplish certain results, and we have managed to have 80 consecutive days whereby there was no local infection. It's not until when we had the first case of Omicron infection that we had the fifth wave of infection, and after the Chinese New Year, the situation got worse, and today we had over 4,280 confirmed cases, and the situation is really very serious. In fact, initially, when we first had the infection, during the Chinese New Year, during the first 3 days, we managed to close off 3 areas in order to stop the chain of infection. And for those healthcare professionals working at the front line, we should highly acknowledge and recognize their contribution, because they have been able to work very efficiently, and therefore they deserve our admiration and respect. Probably because we've been able to do very well during the past few waves. That has resulted in our being overconfident when it comes to the fifth wave. And when it comes to the fifth wave, we are now rather exhausted at different fronts. And the administration still insists on the 1.5-meter social distancing measure, but then it's already the 5th wave. And up till this day, the administration is still not able to explain why Omicron can spread so rapidly, and it is not able to come up with a proper narrative of how it's spread. I think we need to have very good guidelines, because we will have to set the standards for prevention. For example, do we have to wear a higher level surgical mask? Do we have to adopt further measures in order to prevent the spread? What about the PPE for medical staff? I think these are of critical importance. Without these studies from overseas, can we engage our own experts to conduct studies? Can we talk to the National Health Commission so that we can get their advice? Because if we are not able to update such guidelines, then we will not be able to come up with very detailed measures to fight it. For example, can we make use of TCM medicine that has been proven to be very efficient and effective in treating COVID infections? We have our own policy on dealing with the pandemic, in particular when the situation is very critical. We cannot just rely on the central government to help us, because after all, we have our own responsibilities. And since the outbreak, for 2 years, we have already had 4 waves of infections, and overall speaking, we have been able to act timely and effectively.
We should have accumulated the necessary experience to cope with the new wave. But so we have to face the greater challenge presented now. We are expecting the peak of the epidemic to come in March, and now, of course, the government has been doing what we need to do, and I thank the central government for the support, and also the country's relevant departments and ministries would extend whatever help is necessary. And the president has asked us to set the top priority for the epidemic programs, that we must make sure that people's life and health are safeguarded. I hope the government should learn from mainland's experience. We should make the best use of the support rendered by the central government so that we can suppress the progression of the virus as soon as possible. Although the government has deployed many people, but mainly we're talking about people within the government structure. The government should find more ways to mobilize the community, especially the healthcare workers in the private sector, and also volunteers in the community. Apart from testing and vaccination, we should also mobilize more people to enhance public hygiene. Mr. President, the SAR government is the main force in fighting the epidemic. People expect the SAR government to shoulder this role and do a job in good coordination so that we can come together and achieve the objective of dynamic zero infection. The people's life can be returned to normal. So I support the motion. It's already after 6:33. It's after 6:30. I would suspend the meeting after Dr. Hon Starry LEE has spoken. Dr. Hon Starry LEE. Thank you, Mr. President. I would like to thank all the frontline people the healthcare workers, the volunteers involved, the civil servants and discipline forces for their contribution. Apart from frontline healthcare workers, the consensus and participation of all people in the community would be very important. But there are voices before this wave of epidemic set in. Many people have raised doubts about the objective, the dynamic zero objective. I think the SAR government must elaborate on the reasons why. There are countries trying to live with the virus. If we look at the mortality rate of these advanced countries like the US, is 0.7% or 0.2%. In other words, if we apply this to Hong Kong, it means that we are expecting to take a loss of 20,000 lives. Is that something we as a community can live up with? Actually, we have different ideas about the importance of life. So we cannot simply copy what these Western countries have done. The government must explain what the rationale behind the policy objectives. I'm also going to submit in writing some other policy proposals. I won't repeat what have already been covered, but I would like to mention a few things. First, regarding the Leave Home Safe app. We have tried to bundle the information from different sources so that it can carry a tracking function. But there are people in the community who would be using two mobile phones, one for the Leave Home Safe app and the other for other internet services. It's because the Leave Home Safe app can be used without gaining the access to the internet service. If it's not a real-time app, then the tracking and location identification functions are lost. So we must make sure that there are real-time functions of this app. So there's some changes to the app must be made. Secondly, many members have asked that we should use TCM, Chinese medicine, for treatment. But there are some supporting measures required before we can do that. But under the registration procedure of TCM, the supply chain of TCM is severely restricted. Some people talk about the recent phenomena that certain proprietary Chinese medicine has seen prices rocketing. Some of these proprietary medicines are registered in the mainland but not in Hong Kong. Therefore, they are not allowed to be marketed here. If we are to promote the use of TCM on certain confirmed cases, we may wish to establish certain green channels for TCM register in the mainland so that they can be used in Hong Kong. So that's I want to supplement these 2 points. Others have been mentioned by other members. I'll support the meeting until 9 a.m. tomorrow.